I describe that a gene is like an instruction guide for how your body grows and develops. We've got 20,000-ish plus genes in the human body. There's more that we have yet to discover. And so my goal in the Heart Center is really focusing on what are the genes that are important for different types of heart disease, and specifically my patient's heart disease. What's the best way we can capture that through a genetic test to try to give more answers to this family? Hi, my name is Sarah Jurgensmeyer Langas, and I'm a genetic counselor in the Heart Center at Lurie Children's. A lot of times, as a genetic counselor in the Heart Center, I'm meeting with families whose child has been diagnosed with some type of heart disease. That could be anything ranging from congenital heart disease that was diagnosed prenatally. That could be congenital heart disease diagnosed shortly after birth. It could be that their child developed cardiomyopathy later in life, or an arrhythmia condition like long QT syndrome. We're trying to figure out how can we better understand why this happened, how could this happen again for future children, for other family members, and how can we use that information to best provide care and management. I really hope to empower families that it's about what's right for their family and their child. And if that answer to them is genetic testing, great, then we move forward with genetic testing. A lot of times that means that we're doing some type of blood test or like a cheek swab, any way that we can look at someone's genetic code, and we're reading through that genetic code, almost kind of like you're spell checking a book, and you're trying to see, could there be some variant, some genetic change in that genetic code that's telling your body how it should be growing, how it should be developing. And so a lot of my role when we get genetic test results back is doing my own independent review of the results, seeing how do these results actually align with my patient's presentation. So genetic testing, I think, if we find an answer, if we find a diagnosis, it allows us to just take a step back, a zoom back scale of that child's medical care at that time point, and just really frame everything. It helps with planning for long-term management. It helps with how often should we come to the doctor. It helps with what kinds of doctors should we even be seeing, who in the family needs to be seeing these doctors. We're really fortunate that we have so many different genetic counselors throughout the whole hospital. So we've got genetic counselors in the fetal health team. We've got genetic counselors who are embedded in the inpatient services. And at the Heart Center, we're working closely with all of those different team members. I think that genetic counseling allows for really holistic, patient-centered care.